Good morning all, dignitaries on the dais and dignitaries off the dais. So first of all, I would like to start off by congratulating Dr. Rajan sir and his team at Sapiens Foundation for organizing this workshop on a very important topic. I'm also thankful, sir, for giving me the opportunity to share my thoughts and inviting me and my colleague Dr. Manishka Sharma, who leads our entire salt reduction portfolio. So, and I'm very mindful of Sundarji's request also for strict time management. So I assure you I won't take more than 5 minutes. So in the next 5 minutes, I'll just talk briefly about who we are, what we do, and why this workshop over here is so very important for us. So Resolve to Save Lives is a global not-for-profit. We are headquartered out of New York, and we have country offices in India, Nigeria, China, and Ethiopia. India remains one of our largest portfolio. We started our journey around 7 years back, and we were set up by Dr. Tom Frieden, a global public health leader who also served as the director of Center for Disease Control in Atlanta, and who had actually overseen the entire global Ebola response. So when he started it off, there were two issues that we identified to work on. The first one was cardiovascular health, very much a neglected area, and as Dr. Selvavinagam mentioned, if you look at the global burden of disease, NCDs, and within NCDs also it was cardiovascular disease. The second one was prevent epidemics. So these were the two areas that we identified. But then how do we work and how do we move forward? So recently one of our global board members mentioned that within 7 years, we have been really able to achieve disproportionate impact for an organization of our size, scale, and funding. And the reason for that is partnership. The reason for that is we were set up as a global partnership, and we work in partnership with local governments, with academia, with civil society, with healthcare providers. And that is our real mantra for success. Now the challenge that we have set for ourselves is a huge ambitious goal. How do you save 100 million lives from cardiovascular disease? Now to achieve that, we have identified a three-pronged strategy. First is how do you ensure that we are able to enhance the global hypertension control rates, which are averaging around 12-14% to up to 50%. How do you ensure that we are able to reduce the dietary salt intake by 30%? And how do you ensure that we eliminate the harmful trans fats from the food supplies? So these were the three-pronged strategies that we identified for our cardiovascular health. Now, if you look at the disease burden, it's staggering. Globally, hypertension accounts for more than 10 million deaths annually. It's combined than all the infectious diseases put together. This is much bigger burden than what the COVID pandemic was there in front of us. If you look at India itself, we are having an estimated prevalence of around more than 200 million people suffering from hypertension. Sir, I was wondering if at the registration counter we would have just kept a BP monitor or a blood diabetes. We would have realized at least 1/3 of this audience itself would have been hypertensive and diabetic. Now, against all of that, in India, in the last 7 years, we have been able to achieve a lot of successes. On the hypertension control front, we were proud partners to work along with the Government of India, the World Health Organization, and Indian Council of Medical Research to launch the India Hypertension Control Initiative. 7 years back, no one was talking about hypertension. Now that has become a national priority now. As we speak, there are more than 9 million patients of hypertension diabetes on treatment as a part of that initiative, which has spread across the country. It's even there in Tamil Nadu to more than 150 plus districts. Now this has been taken over by the National Program for Non-Communicable Disease by the Ministry of Health and Family Welfare. On the trans fat, we worked with a range of partners to work with FSSAI, and India became one of the few countries in the region which has now got a policy for trans fat elimination. Now it is taking it to the next level of looking at implementation. Now, sodium reduction is the tough nut, and really the toughest nut to crack, as my colleague always keeps on mentioning, Manika. So we know that excessive intake of salt is a key risk factor. We know that salt reduction is so very important for hypertension prevention and management. It ends into a vicious cycle. We have heart disease, and we have chronic kidney disease, and we have strokes. But at the same time, we know that twice of the recommended levels is what our dietary intake is. So how do we achieve that? Now, over the last several years, we have been working on different initiatives. In the state of Karnataka, we are working on the midday meal school program to reduce the salt intake. We are working with the partners such as Public Health Foundation of India to look at Salt substitutes such as LSS, low sodium salt, generate evidence in the Indian context. We are working on front of package labeling that Chelo Vinayagam sir spoke about. We are also looking at economic modeling to look at the impact of taxation on high fat, high salt, high sugar products. But it's a long journey and a very uphill task. What gave us a lot of confidence was, and which was very inspiring, was the Silver Jubilee function of the Sapiens Foundation, which was held last year. The way Rajan sir was able to mobilize a whole of society approach. There were politicians and celebrities and healthcare providers and the local communities. All of them were part of this movement, so as to speak. So that gave us the confidence that if we are able to tap into the work that is already being done through the low salter group. So what is here being done over here in Chennai is just a start of a movement. It will now spread under Dr. Umesh Khanna's leadership also to Mumbai and Delhi and other parts of the country. We really are hopeful that this will show the way not only for Tamil Nadu but other parts of the country and also other parts also of the world, where this can serve as a positive model, where we can get mobilize the healthcare providers as agents of change. Because one of a very critical research finding that we had found about was healthcare providers are considered as one of the most trusted source of information, and their role is very, very critical if we have to achieve the goals of salt reduction. And we are very fortunate, sir, that Vinayagam sir, you are over here, because we have realized that no scale and impact can come without the government. And your partnership is going to be so very critical. What we are doing over here with the private providers can definitely be taken over by the government in the Tamil Nadu health system also. Recently, sir, at one of the events that we had organized on salt reduction, we had the Director General of NCDs, Dr. Swasti Charan sir, who was there. And he was saying that after looking at all of that, the audience and the discussions and all, he said, it's like the tap is open, we are mopping the floor. So till the time we work on the modifiable risk factors, it's really the burden of NCDs is not going to be an easy task for us. I would just like to end with one data point. By the time, sir, we finish off this workshop, in the next 4 to 6 hours, there will be 1,000 people who would have died across India because of cardiac disease, because of strokes and because of chronic kidney disease. I think it's our moral obligation that we do everything possible in our hand to ensure that these lives are prevented. Thank you very much. Thank you, sir. Thank you.